Hello, and thank you for joining me. My name is Sara Tabtabai, and I'm an advanced heart failure and transplant cardiologist at the Yale School of Medicine. Today, I'm here to discuss heart failure. Heart failure is common. It affects approximately 6.7 million adults over 20 years of age in the United States, and it's responsible for about 15% of all causes of death. The heart failure syndrome is a chronic, progressive condition where the heart cannot pump blood effectively to meet the body's needs. The symptoms of heart failure are commonly shortness of breath with daily activities or when lying down, swelling in the legs and ankles, abdominal swelling, and weight gain. There are different types of heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. Ejection fraction is a measurement of how much blood your heart can push out the body with each beat. It is measured by an echocardiogram or ultrasound of the heart or a cardiac MRI. A normal ejection fraction is between 55 and 65%. When this number is below 40%, it is considered reduced, and above 50% is considered preserved. If the ejection fraction falls between those numbers, we refer to it as mid-range and treat it very similarly to heart failure with reduced ejection fraction. The risk for developing heart failure increases with certain medical conditions. These include coronary artery disease or plaque within the heart arteries that can block off blood flow to the heart muscle and lead to heart attacks. Diabetes, high blood pressure, and obesity, as well as heart valve disease, can all lead to heart failure as well. Adverse pregnancy outcomes in women, including hypertensive disorders of pregnancy and preeclampsia, can also lead to increased risk for heart failure in women. So be sure to discuss these issues with your doctor. Lifestyle factors can also increase the risk for heart failure. Smoking, diets high in fat and cholesterol, excessive alcohol intake, and lack of physical activity all can increase your risk. The best data for lifestyle measures to prevent heart failure is to achieve and maintain high levels of fitness and maintain a normal body weight. The treatment for heart failure depends on the type of heart failure. When I meet a new patient with heart failure with reduced ejection fraction, we'll do investigative testing for the cause. And I tell patients that about half the time we don't find a clear cause for this type of heart failure. Within that half, sometimes genetic testing can give further information. Patients can be found to have inherited a gene that makes them more susceptible to developing heart failure. Regardless of the cause and whether or not we can clearly identify it, we treat all heart failure with reduced ejection fraction similarly. The goal is to initiate guideline-directed medical therapy, or GDMT. This is a group of 4 classes of medications that have been shown to improve or stabilize heart function and symptoms, also to keep people out of the hospital and prolong life with heart failure. When combined, these medicines have shown a 74% risk reduction in mortality and 85% risk reduction in heart failure hospitalization. The goal of the medications is to achieve somewhat like remission of heart failure symptoms and ideally improvement in ejection fraction. These medications are continued indefinitely in an effort to maintain the improvements in function and symptoms. If the medications are stopped, the ejection fraction can worsen again, so it is important to discuss medicine changes with your cardiologist. The medical therapies for heart failure with reduced ejection fraction are so effective these days that when I first meet a patient with this type of heart failure, I tell them that I fully expect to see some improvement in their heart function over the next several months with initiating these medicines and getting them to the maximum doses tolerated. If we don't see improvement with these medicines, then we can discuss additional medical treatments or device-based therapies that we also have available. For heart failure with preserved ejection fraction, there used to be very limited treatments. We focused on using diuretics or water pills to help with symptoms of heart volume overload and treat medical conditions such as high blood pressure. However, over the past several years, new treatments have emerged that improve outcomes in this type of heart failure as well. Medical conditions such as obesity and sleep apnea are also a major focus of therapy, and I refer nearly all of my patients with heart failure of any type for sleep studies and treat their obesity. So thank you for joining me today to discuss heart failure. I hope you'll agree that the future is bright for patients diagnosed and living with heart failure as we have newer treatments that work to improve your quality and quantity of life.